Hi, on International Men's Day, I just want to talk to you a little bit about men's mental health. My name's Dr. Thomas Richardson. I'm a clinical psychologist and I work in the mental health team for Solent NHS Trust in Portsmouth. So, men are prone to the same mental health problems that women are, and what I know from my clinical experience is that fortunately some men tend to maybe bottle stuff up, try and cope alone, try and struggle on with things without asking for help and leaving a bit longer. And I've worked with people who have kept really difficult things from the past to themselves for a long time, years, before something happens to kind of blow it all out of the water and they really sort of hit crisis point and start to struggle. Unfortunately, 3/4 of the suicides in the UK are from men. I think part of that might be to do with not seeking help and not talking about things. Equally, when you're experiencing, everyone has difficult days, everyone feels anxious at times. It doesn't mean you have a mental health problem. But when it goes on for a long time, when you feel like you are struggling, when it's really impacting your day-to-day functioning, whether that's work or social, just try to talk to someone, try to ask a health professional for some advice. And I know from my own experience, I've got mental health problems, and when I've been down, it can be hard to ask for help, and maybe you catastrophize about how people are going to react. And I think most of the time for me and for my patients, telling people they have a good reaction, and it really does just help to be able to bounce your feelings off someone else and get the kind of inside feelings out a bit and start to think about ways you can cope with it. It's kind of like downloading these worries by talking to someone. So it's really important just to try and say how you're feeling and be open with people rather than struggling alone, because most of the time actually people, I hopefully, will react well. And some of the patients I've worked with are men who have been quite worried about how their friends will react or family will react when they tell them about, for example, past abuse, and actually they've found that people have really been understanding and validating when they have told them. So talk about things. If you're feeling down, try to keep active socially, even though it feels hard. Try to get some exercise, that can really help as well. If you're anxious as well, just try and do things one step at a time. Try and kind of just push yourself, face your fears. Something that I find really helpful and I always teach my patients about is mindfulness. It's one of those buzzwords that gets a lot of press, but if you really practice it, it can really help you be aware of when you're struggling, and it can really help stop those kind of niggling thoughts just spiralling out of control and leading into a dark place. Solent NHS Trust have done some mindfulness exercises online. If you just search on YouTube for Solent NHS Mindfulness, and they're absolutely free for anyone to use. So I'll leave you with that thought, and all the best.